Namaste. This is JV'n Dr. Rakesh Sharma, Professor, Department Organon of Medicine and Homeopathic Philosophy, JAYOTI VIDYAPEETH Women's University, Jaipur. In this class, practical class, we are going to discuss case taking, or we can say case receiving. This part is very important in homeopathy practice, because if we take proper case taking, if we follow proper rules regarding taking the case, then we can easily cure, we can easily select our simile. So whole selection of the medicine, whole cure of the disease totally depend on the case taking. If we take proper case taking, if we properly understand the case, properly understand the person, then we can easily treat any kind of disease, either acute disease or chronic disease. So case taking is very important aspect in homeopathy practice. There are very unique way, very peculiar way in taking the case. How you thoroughly taking the symptoms, taking the picture of the disease, taking the totality of the symptoms are very much important. There is difference in acute case taking and chronic case taking. Acute case taking is not so long, but chronic case taking is a long process to understand the person, the disease, his past history, his family history. So there are many other important points we should consider while taking a chronic case. So first of all, I want to give some basic information regarding the case taking. That is the foremost step towards making a good prescription is a well taken case. How beautifully Dr. Hiniman writes is the foremost step towards making a good prescription is a well taken case. If you take case properly, then our chances of success will be greatly increased. If the physician clearly perceives is to be cured, there are some objects while we take the case, physician should have some points very clear. I want to share aphorism number 3 before proceed. Now, Dr. Hiniman says in this aphorism, if the physician clearly perceives what is to be cured in disease, that is to say, in every individual case of disease, means if physician clearly understand what is to be cured in disease, in whom to be cured in disease, how I individualize the picture, how beautifully I portray the picture of the disease, means picture of the person which is suffered from disease. That is very important. We have to understand the person. We have to understand the person at mental level, at physical level also. That is very important. So what is to be cured in disease? मुझे disease में cure क्या करना है? I cure the person. That is to say, in every individual case of disease, means in every diseased condition, either acute or chronic, our focus on that particular person. Next is the knowledge of disease indication. If he clearly perceives knowledge of disease indication, this point comprises allopathic aspect as well as homeopathic aspect. On the allopathic aspect, we can diagnose the disease on the basis of the common symptom of the disease, but there is no value in homeopathic prescribing. Only these symptoms are beneficial in the clinical diagnosis of the disease. But if we want to make homeopathic prescription on these common symptoms, then these common symptoms are useless for us. We can't make prescription on these symptoms. So what have to do for the prescription point of view? We have the knowledge of characteristic, peculiar, rare, uncommon symptoms. I want to say basically these symptoms indicate the person who is suffered from disease, indicates the individuality of that person. So how beautifully we can understand a person through the eyes of peculiar, uncommon, rare symptoms. And these are sure guaranteed results. When we prescribe our medicine on these individual symptoms, characteristic symptoms, then we can claim that we can cure this disease, either acute or chronic. Now we move to next point. What is curative in medicine? That is to say, in each individual, means we have proper knowledge of our materia medica, means we have proper knowledge of our medicines, what are the characteristic symptoms, what are the keynotes, what are the peculiar symptoms. All those characteristic symptoms of each remedy we should have in our mind while prescribing. Next point is knowledge of medicine, medical power, and if he knows how to adapt according to clearly defined principle. So in this PPT, we basically know about the knowledge of disease, what is to be cured in disease, and second is the knowledge of medicines and as well as knowledge of medical powers. What is curative in medicine? To what he has discovered to be undoubtedly morbid in the patient, so that recovery must ensure to adapt it as well in respect to the suitability of the medicine most appropriate according to its mode of action to the case before him, means choice of the remedy, the medicine indicated, means how we know the indicated medicine. Only there is one way through we can know the indicated medicine, that is the sign and symptom of the case, through the totality of the symptoms, through the characteristic rare peculiar symptoms. Through this we can easily know or indicated medicine. Respect to the exact mode of preparation and quantity of it required. Next thing is the, if we select proper homeopathic remedy, then next part is in which form we should give medicine. Means in the dry dose method, in liquid form, or in LM potencies, in which form we should prescribe properly our selected medicine. And the proper period for repeating the dose. The next point is very important, that is the repetition of the dose. In the last PPT, we discussed about the dose. Our dose should be in minimum form, in smaller dose. And this dose we want to give in dry form or in liquid form. The next thing is the how we repeat the dose. That is very important. If we unnecessarily repeating our doses, then there is the chances of homeopathic aggravation and development of new symptoms. So we should avoid these type of complications. Finally, he knows the obstacles to recovery in each case and is aware. Namaste, this is JV'n Dr. Rakesh Sharma, Professor, Department Organon of Medicine and Homeopathic Philosophy, JAYOTI VIDYAPEETH Women's University, Jaipur. In our last lecture, we discussed some introductory part of case taking. So we will continue. That is in the last lecture, we discussed about and that is physician should have knowledge regarding the knowledge of disease, knowledge of medicine, knowledge of medicinal powers, and dose also. Today, we are going to discuss the repetition of the dose. We should very careful while repeating the dose. If you are careless in this part, then your chances of spoil your case 100%. Because in homeopathy, case taking is very important, as well as case management part is also very important. If you don't properly manage the case, then there is lot of chances of spoiling your case, even you select proper homeopathic medicine. So when solid indication of repetition of the dose, then we should move further. There are different aspects of repeating the dose, in which in 4th edition Dr. Henneman mentioned, that is, after giving the dose in dry form, physician should wait and watch. And this wait and watch method or time, there is no fixed limit, because according to 4th edition, we should physician have some fear in his mind, that is, if I prematurely repeat the dose, then there are lot of lot of aggravation we will face. So according to 4th edition, physician only one chance only, that is to wait and watch method. So there are lot of homeopathic physicians, they prescribe accordingly fourth edition method of organon of medicine. So fourth edition method is the wait and watch method, कि जब तक हमारे पास में कोई क्लियर कट इंडिकेशन नहीं आ जाता मेडिसिन को रिपीट करने का, तब तक हम रिपीट नहीं करेंगे. And after that, after fourth edition, in fifth edition, Dr. Henneman just refined his method of dosage, in which in fifth edition, Dr. Henneman advises us that is medicinal dose should not be prescribed in dry form. They advises us medicine should be prescribed in liquid form. This is the time of before LM potencies are not introduced. But Dr. Henneman works on this. So in fifth edition, Dr. Henneman advises medicine should be prescribed in liquid form. And in the sixth edition, as we know, that is the introduction of LM potency. And there is very big difference in fourth edition and sixth edition and fifth edition. That is the Dr. Henneman advises in fifth and sixth edition, we should continue our medicine even amelioration of the patient. But the condition is our medicine should be prescribed in a liquid form. That is the exception. That is the only one condition which is very necessary. Next thing is the what type of obstacles we have to face after prescribing the medicine. So physician should have the knowledge of obstacles. There are many types of obstacles from the patient side, from the family side, and also from physician side also. Physician should have to look other aspect also, maintaining causes. So physician should have thoroughly knowledge of such obstacles that hinders the progress of the case. And the next is the how to remove them. That is very important. How to remove them, and as well as how we convince patient regarding the maintaining causes, regarding the obstacles of the case. Because if we don't give any consideration on these points, maintaining causes, वगैरह, then we can't expect the restoration of the health. Next is the how to treat judiciously and rationally. That is the again very important point. Means how we judiciously use our principles of homeopathy and how we select our simillimum. Our object of treatment is the person who is suffering. So to understand that person, his behavior wise, his temperament wise, his constitution wise, so all aspects should be consideration while selecting the remedies, and as well as we should follow the principles of homeopathy. That is the single medicine, single dose, minimum form, like this. And he is a true practitioner of the healing art. Then physician is called true practitioner. What is the meaning of true practitioner? Who follows the principle of homeopathy. Huh? His object of treatment is the person, not the disease aspect. Then he is the true practitioner and healing art. And that is the art how he efficiently use medicine, proper repetition, and principles of homeopathy. The art how he select the totality of the case, how he chooses the symptoms. That is the art of the physician. So we have understand about the importance of case taking, some basic introduction of case taking part. Now, case taking is an art. Again, very beautifully written by Dr. Henneman. It's an art. Why he says art? Because physician should have ability to portray the true picture of the disease, to portray the characteristic symptoms in the totality of the case. So, case taking is an art on which the success or failure depends. A proper case taking is essential for the success process of the study of the repertory and the repertorization. So, while prescribing or while dealing with the case of the disease, there are 3 points are very important, very necessary. That is the knowledge of the organelle. Second aspect is the knowledge of the materia medica, and the third is the repertory. Now the art of the physician is how he beautifully uses all these subjects, all these 3 subjects, materia medica, organelle and repertory. That is the art of the physician. Further, the art of the physician in taking the case must so record it that we may glean from this record those elements that may be translated into the rubrics of the repertory. Means the language of the patient, the words of the patient, we have to convert in the rubric form so that we can easily and differential diagnosis of the remedies between, and all remedies belongs in a particular rubric, so we can easily find there. However, it is impossible to secure from the patient a clear-cut picture of his difficulties in spite of the best art the physician may exercise. Talking to the patients and obtaining their health histories are usually the first and often the most important parts of the health case process. So, talking to the patient and obtaining their health histories are usually the first and often the most important part of the health case process. So, the first primary thing is you have to start talking with the patient. That is also an art how you efficiently talking with the patient, how you elicit the information from the patient, because there are different type of the patient, different type of the temperament, and some patients are very secretive in nature, their behavior is hiding, so there is lot of difficulties while eliciting the symptoms from such type of patients. So again, this is an art of the physician, how he efficiently obtain the information from the patient. So this is our introductory part of the case taking. In next class we will discuss more about case taking. Thank you.